Pulse is a palpable rhythmic expansion of an artery, produced by the increased volume of blood thrown into the vessels by contraction of the heart. A pulse point is an area where major arteries are close to the skin's surface and lie directly over a bone. When locating the carotid pulse, you normally want to do this in unconscious individuals who are over 1 year of age. To locate the carotid pulse, kneel perpendicular to the athlete. Place your index and middle fingers in the midline of the throat, approximately at the thyroid cartilage. Then gently slide your fingers towards the side of the neck in the groove between the trachea and the sternocleidomastoid. When finding the brachial pulse, this is most commonly used on infants under 1 year of age. To locate this, place the infant in a supine position with their arm rotated to 90 degrees, exposing their inner arm. Place their index and middle fingers perpendicular to the midshaft of the upper arm, and gently compress your fingers between the triceps and the short head of the biceps and coracobrachialis. To locate the radial pulse, you would normally do it on a responsive individual. To locate it, place your index and middle fingers perpendicular to the distal end of the anterior forearm on the radial side of the wrist. You do not want to use your thumb because you can get your own pulse by doing that. Gently press down on the artery between the flexor carpi radialis and the brachioradialis tendons.
First, secure the blood pressure cuff around the upper arm about 1 inch above the elbow. Then locate the brachial pulse, which is on the inside of the elbow. At this time, you want to place the stethoscope earpieces in your ears with the tips facing away from you. Using your non-dominant hand, place the diaphragm of the stethoscope directly over the pulse site. Make sure not to place it under the cuff. Now, using your dominant hand, close the valve on the ball pump and inflate the cuff to around 160 millimeters of mercury, or 20 millimeters of mercury above the point where sound was lost. Slightly open the valve on the ball pump and deflate the cuff 2 millimeters of mercury per second, and at the same time, watch the pressure gauge while listening for the tapping or clicking sound of blood pressure. The first point at which you start hearing the sound is the systolic BP. Continue to slowly deflate the cuff until the tapping or clicking sound is no longer heard. The point at which sound stops is the diastolic BP. Now you can fully open the valve.
Secure an appropriately sized blood pressure cuff just as you would with taking blood pressure with a stethoscope. Using your non-dominant hand, identify a radial pulse. With your dominant hand, hold the pump and begin inflating the cuff until the radial pulse under your fingertips disappears. Continue inflating the cuff 20 millimeters mercury above the point of lost radial pulse. Slowly deflate the cuff at 2 millimeters of mercury per second until the radial pulse returns. Record this number, which is your systolic blood pressure over palpation. You cannot get diastolic blood pressure with this method.
Assessment of an individual's respiratory status requires evaluation of the respiration rate and the quality of breaths. During the primary assessment, you will evaluate for quality of breaths by checking to see if the chest rises or falls evenly or unevenly, trying to hear and feel an exchange of air through the nose and mouth, noticing any obstructions, and listening for any unusual breath sounds. Respiration rate is the number of times a person breathes in 1 minute. 1 breath cycle equals inspiration and expiration. When assessing respiration rate, you can simply watch the chest rise and fall to determine the number of breaths in 30 seconds and multiply this number by 2 to find the number of respirations per minute. Make sure the athlete does not speak and is unaware of you taking their respiration rate, because this could cause a change in breathing pattern. A good way to ensure the athlete is unaware of you assessing respiration rate is to feel for the radial pulse and move the forearm to the rib cage.